realize is that each of those kinds of drugs that I have just referred to categorically contains a pharmacological component that acts upon the brain in a depressant fashion. And when you take them collectively, then that combined effect on the brain leads to respiratory depression. The diminution of lung function insults the heart, further insults the brain, the heart beats irregularly, and then you go into cardiorespiratory depression, cardiac arrest, and death. We see this. I had 3 autopsies yesterday. 2 of them were the kind I speak of. I just did one an hour and a half ago, and it also was this kind of case. So 3 of 4 coroner's cases in 2 days, and this is typical of what we are encountering. There were some articles, you may have seen these, folks, Ned Albert, you may have seen these in the newspapers just a few days ago, maybe last week, talking about the marked increase of such drug abuse deaths in America. And we're witnessing this, I can tell you, in coroner and medical examiners' offices throughout the country.
I have another question for you. What is your professional opinion and conclusion of Michael Jackson's death?
Well, it's a death that should not have occurred. Ironically, paradoxically, the doctor charged with keeping him alive, who was being paid reportedly $150,000 a month, Dr. Conrad Murray, did not do a very good job. In fact, he's admitted this, that he administered these drugs to Michael Jackson. That night, he started off with some Valium, and he gave some Ativan, and then he gave Versed, and then he gave some more Ativan, and then he gave some more Versed, and then he finally gave Diprovan, propofol, which is a powerful anesthetic, and Michael Jackson died. And then it took him almost an hour to call 911. He was making a bunch of other calls, obviously, to people, what are we going to do, what are we going to say, how are we going to handle this, rather than dealing with 911 and seeing whether or not there's any chance of resuscitating and salvaging Michael Jackson. So I believe and predict there will be homicide charges brought against Dr. Murray. I predict there likely will be other criminal charges, not necessarily homicide, but other criminal charges brought against other doctors and pharmacists who gave drugs, who prescribed drugs, many times to fictitious people, knowing that they were really for Michael Jackson. You'll see, you haven't heard the end of this by any means.
Okay, I have a follow-up question. Do you feel that, and I'm sure you'll probably say yes, but I don't know. Do you feel that being that Michael Jackson was, in fact, Michael Jackson, the multi-millionaire, and other people such as Elvis Presley back in the 70s, and many of the celebrities, both,
Anna Nicole Smith,
right.
Heath Ledger.
Do you think that the reason why this is happening is because nobody wants to say no to them? You think that has a lot to do with it?
Yes. I think that you have hit the nail right on the head. As I've already said, we see these kinds of deaths happening all the time. But with regard to these celebrities, there's no question that they get themselves one or more doctors who do not say no, who are unwilling to say no. Absolutely, there's no question. And it's bad medical practice. And when it results in death, I believe, and I'm not a hard-nosed prosecutorial type, but I do believe that it is not at all illogical or irrational to proceed with criminal charges against such physicians.
I agree, because I think also it makes the public perception of a person, it damages their reputation. People have said that Michael was a drug addict, and that's not necessarily the case. I do feel that if you get in a position where people say they won't say no, but then also it's not just that they won't say no, but it's the money that's involved. Like you said, $150,000, which is at least almost $2 million a year.
Well, yeah, but of course there he was supposed to be in a position to see to it that Michael Jackson was not abusing drugs. So it's a little different from being paid off to give drugs. We're talking the point you made about doctors who not doing it for money, they're doing it to suck in with the celebrity. They're sycophants. This happened with Elvis Presley, with Dr. Nicopolis, and this has happened with other doctors. And by the way, this month in Los Angeles, there will be a preliminary hearing against 2 doctors who did this with Anna Nicole Smith, who prescribed drugs, Dr. Kapoor and Dr. Arosovich, and Howard G. Stern, her lawyer and longtime friend, confidant. This will be the preliminary hearing scheduled to begin in a couple of weeks this month in Los Angeles.
Well, I agree that people that do that should be actually apprehended and prosecuted for. We do actually have a question from the audience. That would be Nancy, and then I have some questions for you. But Nancy Way to the left of you, and she has a question.
After, like when Michael Jackson, they came back on the news, and they said he didn't have much arthritis, and they said he was in fairly good health.
That's correct. As a matter of fact, that's a good point you raised in your question. The report has been released unofficially, obtained by Associated Press, and I've talked with an Associated Press reporter, and I also talked with someone else in Los Angeles just last night, so it appears to be a valid report, and that is that really Michael Jackson was not in a bad state of health. So the idea that they had to give drugs to take care of this. He did not have any malignancy. He did not have lupus erythematosus. He did not have any kind of severe dermatological condition. He had a lot of problems with his skin, but they were related to all of that cosmetic surgery and so on. But he did not have underlying disease processes. Also, contrary to what had been reported originally, that he only weighed 112 pounds. He weighed 136 pounds. That's still skinny for a 5'9" guy, but there are people, especially dancers and so on. So, 160 would be maybe around normal. 150 is not so rare. So he was somewhat lower than normal, but not that severely malnourished as to be described as suffering from cachexia or bulimia.
Well, that's very good answers. That's why he's the doctor. Well, you know what, Dr. Wecht, I would like you to take this call, but I want to give a little disclaimer warning. Sometimes we get calls that are not, as we say, kosher. So if that's the case, what I do now is we just basically will say to the staff, we're going to move forward, and then we basically freeze for about 5 seconds.
Albert, it's your show, whatever you say.
No, but I just want you to know if I all of a sudden stop.
Yeah, no, go ahead.
So, but at any rate, if you could be so kind as to get caller number 1.
Yes, please.
Hello there, doctor.
Yes, hello.
Hi, can you hear me, sir?
Now I do, yes.
I just wanted to commend you for sticking in there and still being, I feel, to be one of the best coroners out there. And I really want people in Pittsburgh and whoever else is watching this to understand what financial difficulties you probably suffered. And I can see you're laughing, but thank God you have a sense of humor. But I cannot believe that they would character assassinate you and run you through the loops that they did. And thank God you're still kicking. You're the same age as my father, who passed away April 5th of 2008. And Dad always thought perhaps you were a little bit hoity-toity or what have you, but he said you were a hell of a good forensic pathologist.
Well, I thank you, sir. Very gracious and thoughtful. My laughter was really the laughter of pain when you referred to financial difficulties. I was just thinking of what it cost and how much I still owe. So, it's we say sometimes that we're really in agony and we laugh rather than burst out in tears. But I appreciate your comments. I'm sorry about your father. Please accept my personal sympathies. And thank you, sir, for your call.
Thank you.
All right, and I want to thank you for your call. And also, I understand that it did cost you something like $2 or $3 million. Is that accurate?
I think, Albert, we haven't added up.